Hey guys, you haven't really seen me a lot outside of the workout, so I wanted to kind of pop in and talk a little bit. So one of the common things that I deal with as a physical therapist is going to be knee pain. Knee pain is a very common problem, and it can come on especially when you start to be more active. So that's what a lot of you are doing. You're becoming more active, you're doing all these new exercises. Sometimes knee pain can occur. So I just want to give you guys a little background on what knee pain really is, what it could be, and when you should actually go and see a doctor for it. So to start, the structures of the knee, you have your ligaments. So you've probably heard of an ACL, an MCL, PCL, and LCL. So those are all just ligaments, bone-to-bone attachments that are on every side of the knee to help support, stabilize the knee. Then you have your femur, so that's the long bone coming from your hip, and then the tibia underneath, that's your lower leg, goes into your ankle. So those are the bones, those are the ligaments. Now you have a couple other things in the knee. So you have your patella, your kneecap. There's a tendon that goes into the top of the kneecap, and then one that comes below onto the tibia, onto the lower leg. And then within the actual knee joint, the primary thing is going to be the articulating surfaces. So you have the femur on top of the tibia, and when they flex and extend, they rub on each other, right? Then you have the cartilage on either side, and then you have your meniscus. There's a meniscus on either side that can be torn. That's a common injury. So those are all the main structures in the knee. And most people just deal with osteoarthritis. So it's joint inflammation from the wearing of the surfaces that are rubbing on each other when you flex and extend the knee repetitively. And that's usually what the common concern is, or the common problem, especially as we age. The joint surfaces just degrade, unfortunately. So when it comes to when you should actually before I go into that, then on top of that, not just in the knee joint, but also the patella, so your kneecap actually shifts and goes through this little groove in your femur down towards the tibia, goes through that groove as you flex and extend the knee. That can also be a source of joint inflammation and irritation that can cause some problems. But those are repetitive injuries. They tend to come on just out of the blue, and we call that an insidious onset. Insidious just means you don't know why it happened. Now when you should go and see a doctor, potentially get some imaging, is going to be when you have some sort of traumatic mechanism of injury. So, you twist funny and you hear a pop and now it hurts. You fall on your knee and it hurts now and it's not going away. Those things tend to be, there could be a joint structural problem. So like with all the ligaments, you're gonna feel like the knee's unstable because one of the stabilizing components of that knee isn't working anymore, and it's causing pain. With a meniscus tear, so usually, well, first of all, with the ligaments, usually it's a twisting motion that's going to cause some sort of tear in those ligaments. Same with the meniscus. So a twisting motion, a fast twisting motion, then you have like locking, clicking, catching in the knee. That means that potentially part of that meniscus could be flipped up a little bit into the joint. And then when you flex and extend your knee, it's actually catching on that meniscus that's sort of in the joint space, kind of where it's not supposed to be. And I mean, those are really the main issues that I could see coming out of somebody who's regularly exercising. Now, if the knee starts to swell after a mechanism of injury that's traumatic, then of course, ice, elevate, go to your doctor, see what's going on. But then also with regular joint inflammation from repetitive use, like exercise, the best method to get rid of that is ice, elevate, compress until that pain is reduced. The other thing too, so let's say one of those structures within that knee joint is impaired for whatever reason, either just degrading or some sort of traumatic problem. What you need to do there, if you go get imaging and there's no reason to get surgery, then the point of exercise is to strengthen all the muscles around that joint to help better stabilize the joint. That's true with all joints. So if you're thinking about taking a step from the floor, the force from the floor goes up into your leg, up into your ankle, knee, hip, low back, and that force has to be absorbed somewhere. So if you have weak muscles, that force is going to be absorbed into the joint at a higher percentage than into the muscle. So that's the importance of exercise right there, is it helps protect and stabilize the joints. So I hope that was helpful to you guys. I hope you got something out of that. And I will see you guys on my recorded video on Friday.